Let me just also add additional information regarding the informal settlements. And as has been reported here before, informal settlements are hotspots for transmission of COVID-19. And the cases that we have received so far from Kibera stand at 151. Easily we had 121, and in Old Town we had 91. And that is why we are trying to focus more on the informal settlements, where sometimes it's practically difficult to ensure physical and social distancing. So our message there is more of infection prevention control measures and use of masks to be able to prevent aerosolization of the virus when we cough or sneeze or speak. Of course, the importance of provision of water and sanitation facilities in the informal settlements cannot be underestimated in this fight. Regarding the signs and symptoms of COVID, yes, each and every day we learn new things about COVID-19. As Waziri said, diarrhea and vomiting are now cardinal features of COVID-19 disease, especially in the elderly people and the young people, young children. And it is even postulated that there could be a degree of fecal-oral transmission, though this has not been confirmed. But on that plate also, it is important to note that the elderly also have a different presentation altogether. And many of the elderly people will present with lethargy. They also present with delirium, confusion, anxiety, depression. They can have unexplained strokes. Then there is also the loss of the sense of smell or anosmia and loss of sense of taste. They can also get infection in the brain called meningoencephalitis, where the membranous lining of the brain is inflamed together with the brain tissue. Regarding the burials, we have standards and guidelines and protocols that we have developed and we have shared with our counties. And the standards, guidelines, and protocols are cognizant of our cultural practices. So as much as possible, once the body is properly prepared, then the risk is minimal. So there's no justification for doing a burial late in the night. Because once you double pack the body, put it in a coffin or a casket, and you are properly donned with personal protective equipment, then the risk of transmission of COVID to the healthcare workers and members of the family is minimal. Regarding the projections, our case fatality rate stands at 3.8%. And if we pick as the projections indicate in August at about 4,000 to 5,000 cases, then if you take 3.8% of that, it comes to about 160, 180 deaths. Regarding mental health, yes, mental health challenges are very, very apparent during COVID-19 pandemic because of isolation and social distancing, meaning that we don't get into close contact with our families and friends, and therefore there's that loss of the support. That is a hallmark of African culture and behavior. What we are doing is that we have developed again standards, protocols, and guidelines that we have shared with our counties, and we have also brought on board the community health volunteers who are our primary soldiers at the community level to be able to support individuals at the community level. Remember, the community health volunteers are appointed by the members of the community because they know they belong to that particular community. So for this particular case, I would really be interested in knowing where this matter was reported so that we can quickly get into contact with the relevant sub-county health management team to get to see how this family can be supported. Thank you.